Hello students, welcome to this session on hypersensitivity. Hypersensitivity is the injury's consequences in the sensitized host following subsequent contact with specific antigen. So there are total four types of hypersensitivity reactions: type 1, type 2, type 3, type 4. Jane and Coons classification. So there are total four types. Human immune response in type 1 is humoral, type 2 humoral, type 3 humoral, type 4 cell mediated. The type 1 immediate, type 2 immediate, type 3 immediate, type 4 delayed. Duration in type 1 is 2 minutes to 30 minutes, type 2 is 5 to 8 hours, type 3 is 2 to 8 hours, type 4 is 24 to 72 hours. Mediator type 1 IgE, type 2 IgG, type 3 antigen antibody complex, type 4 PDTH cell. Effector mechanism type 1 mast cell degranulation, type 2 ADCC complement mediated cytolysis, type 3 complement activation inflammatory response, type 4 macrophage activation leads to phagocytosis or cell cytotoxicity. Desensitization to the allergen, type 1 easy but short lasting, type 2 easy but short lasting, type 3 easy but short lasting, type 4 difficult but sustained. Typical manifestations: type 1 anaphylaxis, asthma, atopic dermatitis. Type 2 transfusion reactions, RH incompatibility, hemolytic anemia. Type 3 Arthur's reaction, serum sickness, glomerulonephritis, rheumatoid arthritis. Type 4 tuberculin test, granuloma formation in tuberculosis, leprosy, contact dermatitis. Type 1 hypersensitivity reaction, production of IgE by sensitized B cells following a contact with an allergen, which in turn induces mast cell degranulation. These changes ultimately lead to localized response called as atopy, systemic response called as anaphylaxis. Experiments to demonstrate type 1 hypersensitivity reaction, PK reaction, Schultz-Dale phenomenon, and Thibault-Smith phenomenon. PK reaction. K. Prosnitz and H. Kussner in 1921 injected serum from an allergic person into non-allergic individual intradermally. When the appropriate antigen was injected at the same time, a wheel and flare reaction analogous to hives developed at the site. First, to demonstrate antibodies in the serum are responsible for the allergy and it is transferable from one person to another. Wheel flare response occurs in three stages: appearance of an erythematous area at the site of injury, development of a flare erythema surrounding the site, wheel swelling and congestion forms at the site as fluid leaks under the skin from the surrounding capillaries. Schultz-Dale phenomenon demonstrate anaphylaxis in vitro by exposing isolated tissues such as intestine or muscle segments of sensitized guinea pigs to the allergens. Mechanism of type 1 hypersensitivity. So there are two phases: sensitization phase and effector phase, both occurring with an interval of 2 to 3 weeks. Sensitization phase. Sensitization is most effective. Allergen is introduced parenterally but may occur by any route, including ingestion or inhalation. In susceptible individuals, very minute doses can be sufficient to sensitize the host. Allergen is processed by antigen presenting cells and the antigenic peptides are presented to the CD4 helper T cells. Activated Th cells are differentiated into Th2 cells, which in turn secrete interleukin 4, induces B cells to differentiate into IgE producing plasma cells and memory cells. Secreted IgE migrate to target sites and coat on the surface of mast cells and basophils. Fc region, the CH3 and CH4 domains of IgE binds to high affinity Fc receptors present on mast cell surface. Such sensitized mast cells coated with IgE will be waiting for interaction with the subsequent antigenic challenge. When same allergen is introduced subsequently, shocking dose, it directly encounters with the FAB region of IgE coated on mast cells. IgE cross-linkage initiates degranulation. Allergen bound to IgE triggers the mast cells and basophils activation and degranulation. Granules in turn release a number of pharmacologically active chemical mediators that lead to various manifestations of type 1 reaction. Memory B cells further differentiate into plasma cells that supply IgE. Effector phase, degranulation in two phases. So first, primary mediators, the preformed chemical mediators which are already synthesized by mast cells are immediately released. So examples, histamine, heparin, serotonin. So they increase vascular permeability, increase smooth muscle contraction. Eosinophil chemotaxis factor, eosinophil chemotaxis, neutrophil chemotaxis factor, neutrophil chemotaxis, proteases bronchial mucus secretion, degradation of blood vessel basement membrane. Secondary mediators are those which the mast cells synthesize and release. So the pharmacological actions, chemical mediators increase bronchial and other smooth muscle contraction, increase vascular permeability and vasodilation. And the symptoms are breathlessness, hypertension and shock leading to death at times. So the examples are platelet activating factors, leukotrienes, that is slow reactive substance of anaphylaxis, prostaglandins, bradykinin, cytokines, example interleukin-1, tumor necrosis factor alpha. So they cause systemic anaphylaxis, increase expression of cell adhesion molecules on venular endothelial cells. The mechanism, allergen gets exposed to APC, that is antigen processing cell, then that is CD4 plus T helper cells differentiated into T helper 2 cells, then T helper 2 cells in secretes interleukin 4, then which sensitize B cells, then B cells converted into memory cell and plasma cell. The plasma cell allergen specific IgE allergen. So they get sensitized mast cells and then re-exposure to allergen they cause degranulation. So primary and secondary mediators are released and they cause smooth muscle contraction, blood vessel dilatation, platelet degranulation, then sensory nerve endings, eosinophil secretion. Manifestations of type 1 reaction. So first, systemic anaphylaxis, acute medical emergency condition characterized by severe dyspnea, hypertension and vascular collapse leading to death. Occurs within minutes of exposure to allergen and unless treated promptly may lead to fatality. Epinephrine adrenaline is the drug of choice for systemic anaphylactic reactions. Second, localized anaphylaxis, also called atopy. Reaction is limited to specific target tissue or organ, mostly epithelial surfaces at the entry site of allergen, mostly run in families, that is inherited. Examples, allergic rhinitis and asthma. Allergic rhinitis or hay fever, most common atopic disorder, results from exposure to airborne allergens with the conjunctiva and nasal mucosa, leading to appearance of various symptoms such as watery secretion of the conjunctiva, nasal mucosa and upper respiratory tract, as well as sneezing and coughing. Asthma, second most common atopic manifestation, differs from hay fever in involvement of lower respiratory mucosa, resulting in contraction of the bronchial smooth muscles and airway edema, increased mucus secretion, altogether leading to bronchoconstriction and dyspnea. The stimulus may or may not be the allergen. According to asthma classified, one allergic asthma induced by airborne or bloodborne allergens such as pollen, dust, fumes, insect products, or viral antigens. Intrinsic asthma, it is independent of allergen stimulation induced by exercise or cold, food allergy, atopic dermatitis, allergic eczema, drug allergy. Various drugs such as penicillin sulfonamide may produce type 1 hypersensitivity response, which may be either local or sometimes produce systemic anaphylaxis. Detection of type 1 hypersensitivity. So skin prick test. So pricking the skin with required antigen. Advantage, skin test is relatively inexpensive and allows screening of large number of allergens at one time. Disadvantage, it may occasionally sensitize the individual to new allergen and in some rare cases may induce late phase reaction or even systemic anaphylactic shock. Treatment of type 1 hypersensitivity reaction, avoidance of contact with known allergen, hypersensitization, monoclonal anti-IgG, IgE. So, antihistamines, epinephrine, adrenaline, cortisone, theophylline, chromoline, sodium. So, this blocks calcium influx into mast cells. Type 2 hypersensitivity reaction, host injury is mediated by antibodies IgG or rarely IgM, which interact with various types of antigens such as host cell surface antigens, extracellular matrix antigen, exogenous antigens absorbed on host cells, example drug coating on RBC membrane. Clinical conditions are transfusion reaction, erythroblastosis fetalis, autoimmune hemolytic anemia, agranulocytosis, thrombocytopenia, drug-induced hemolytic anemia, pemphigus vulgaris. Mechanism: antibody Fc activating complement system, antibody Fc interacting with Fc receptors on target cells, autoantibody mediated antibody dependent cellular dysfunction or ADCD. Type 3 hypersensitivity reaction occurs as a result of excess formation of immune complexes, that is antigen antibody complexes, which initiate an inflammatory response through activation of complement system, leading to tissue injury. Antigen involved immune complexes can involve exogenous antigens such as bacteria, viruses, and endogenous antigens such as DNA. Antigen-antibody immune complexes stimulate the classical pathway of complement, the products of which mediate the tissue injury in type 3 reaction. Anaphylactoxin chemoattractant. Role of neutrophils. Neutrophil fail to phagocytose large immune complexes. Mechanism of tissue injury. First is the platelet activation. Immune complexes bind to Fc receptor on platelets, leading to their activation. Platelet aggregation leads to microthrombi formation and vasoactive amines released from activated platelets, cause tissue ischemia, leading to further tissue damage. Activation of Hegman factor leads to activation of kinin, which in turn causes vasodilatation and edema. So type 3 hypersensitivity reaction. So first is localized and second generalized. So in localized, it is also called Arthur's reaction. It is defined as localized area of tissue necrosis due to vasculitis resulting from acute immune complex deposition at the site of inoculation of antigen. The reaction is produced experimentally by Arthurs in 1903 by injecting an antigen into the skin of previously immunized animal, that is rabbit. Circulating antibodies bind with the antigen in the dermis and form immune complexes, which leads to fix the complement localized immune complex mediated inflammatory response. That is called Arthur's reaction. So in skin following insect bite or during allergic desensitization treatment wherein repeated injections of the same antigen is given for long periods. In lungs following inhalation of bacteria, fungi, spores or proteins may produce intrapulmonary lesion. Examples include condition causing extrinsic allergic alveolitis such as farmer's lung or bird fancier's disease. Generalized or systemic type 3 reaction. Formation of small size soluble antigen antibody complexes following entry of large dose of antigen in body. Deposition of immune complexes in various tissues, initiating inflammatory reaction in various sites throughout the body, such as blood vessels, causes vasculitis, glomerular basement membrane causes glomerulonephritis, synovial membrane causes arthritis. Diseases associated with generalized type 3 hypersensitivity reactions. Connective tissue disorders due to autoantibodies forming immune complexes with self-antigen. Example, SLE, rheumatoid arthritis, antibody against human immunoglobulin, PAN, polyarthritis nodosa. Parasitic diseases resulting from immunocomplex deposition, nephrotic syndrome in Plasmodium malariae, Katayama fever in schistosomiasis, African trypanosomiasis. Bacterial diseases, Streptococcus pyogenes, post-streptococcal glomerulonephritis, Mycobacterial leprae, lepra reaction type 2. Viral diseases, hepatitis B, arthritis, hepatitis C, arthritis, infectious mononucleosis, Epstein-Barr virus, dengue, arthritis. Other hyperacute graft rejection, subacute bacterial endocarditis, serum sickness. Serum sickness seen following serum therapy, that is administration of foreign serum. Example, horse anti-tetanus serum to treat tetanus cases seen in the past. Horse serum proteins being foreign, they induce antibody formation in the host, leading to formation of large number of immune complexes. Typically, after 7 to 8 days, the individuals begin to show various manifestations which are collectively called as serum sickness. Type 4 hypersensitivity reaction differ from other types. It is delayed type occurs after 48 to 72 hours of the antigen exposure. It is cell mediated. Characteristic cells are TDTH, delayed type of hypersensitivity cells are principal mediators, and tissue injury occurs predominantly due to activated macrophages. Mechanism, there are two phases, sensitization phase and effector phase. So in this diagram, you can see in sensitization phase, there is APC, antigen presenting cells, intracellular bacteria. So there is formation of CD4 plus T helper cells, which leads to activation of the TDTH cells, and they secrete TH1 cells. Then in effector phase, these sensitized TDTH cells, they produce interferon alpha and tumor necrosis factor beta, and then there is resting macrophages which gets activated. So the sensitized PDTH cells secrete cytokines, that is interferon alpha, interleukin 2, TNF beta, then interleukin 3. Then these activated macrophages, they cause activation of class 2 MHC molecules, increase tumor necrosis factors receptors, oxygen radicals, and increase nitric oxide. Type 4HS, the first example is tuberculin test. So tuberculin test is the prototype delayed hypersensitivity in sensitive individuals who possess sensitized TDTS cells due to prior contact with M. tuberculosis. When preparation of tuberculin antigen and extract of M. tuberculosis is injected intradermally, there is local reaction development after 40 to 72 hours consisting of induration surrounded by erythema. And the interpretation, when less than 5 millimeter in duration it is negative, more than 5 millimeter it is borderline, but in immunosuppressed persons it is positive. 1 millimeter is positive in IV drug abusers, children under 4 years of old age, and people with high risk area. More than 15 millimeter in duration positive in the healthy person whose immune system is normal. Here you can see how the injection is given intradermally with help of tuberculin syringe, and then there is erythema and induration development after 48 hours of the injection. For hypersensitivity reaction, second example, contact dermatitis. Many antigens such as nickel, poison oak, etc. act by producing DTH response. Most of these substances are haptens. They complex with skin proteins which act as carrier to make the haptens immunogenic. This hapten skin protein complex is internalized by skin APCs, that is Langerhans cells, and then presented to TH cells to induce ADH reaction. Activated macrophages release lytic enzymes which result in skin lesions. Example, redness and pustule seen following contact with the poison oak. Examples of DTH, intracellular and contact antigens inducing DTH. Intracellular bacteria, example M. leprae, M. tuberculosis, Listeria, and Brucella abortus. Intracellular viruses, herpes simplex virus, variola, smallpox, mesovirus. Intracellular fungi, Pneumocystis jirovecii, Candida albicans, Histoplasma cryptococcus. Granuloma formation seen in tuberculosis, sarcoidosis, schistosomiasis, and other trematode infection, and lepra reaction type 1. Non-infectious conditions, diabetes mellitus type 1, multiple sclerosis, peripheral neuropathies, Hashimoto's thyroiditis, Crohn's disease, chronic transplant rejection, graft versus host disease. Contact dermatitis following exposure to contact antigens, nickel, poison ivy, poison oak, picril chloride. Skin test to demonstrate DTH, tuberculin test, that is Montagu's test, lepromin test, Montagu test in leishmaniasis, and Fry's test in done in LGV. To summarize, hypersensitivity reactions, there are mainly two types, immediate and delayed. So immediate are type 1, 2, 3, and delayed is the type 4. And then type 1 is IgE mediated within 2 to 30 minutes, and mediators are IgE and histamine. So examples, this reaction occurs when antigen binds to IgE on surface of mast cells. This produces release of mediators, histamine, serotonin, prostaglandins. Example, drug hypersensitivity, that is penicillin, anaphylaxis, hay fever, asthma, eczema. Type 2 antibody cytotoxic, and then time within 5 to 8 hours, mediators IgG. It occurs when antibody directed at antigens of cell membrane activates complement which damages cell membrane. Example, transfusion reaction, hemolytic disease of newborn, rheumatic fever. Type 3 immune complex mediated. Time is 2 to 8 hours, and mediator antigen antibody complex. Mechanism, it occurs when antigen antibody complexes induce inflammatory response in tissues. Example, rheumatoid arthritis, arthros reaction, serum sickness, arthritis, and glomerulonephritis. Type 4 cell mediated, occurs in 24 to 72 hours. Mediators are T cells, lymphokines, and macrophages. It is function of helper, that is CD4 T lymphocytes. Example, typical in test. When patient previously exposed to MTB is injected with small amount of tuberculin intradermally, there is little reaction in few hours. Gradually induration and redness develop in 40 to 72 hours. A positive skin test indicates that patient has been infected with agent. Example, contact dermatitis and tuberculosis. Hello students, welcome to this session. Let's study autoimmunity and disorders. Learning objectives are definition, mechanism of autoimmunity, classification of autoimmune diseases, and lab diagnosis. Autoimmunity, a condition in which structural or functional damage is produced by the action of first, immunologically competent cells, second, or antibodies against the normal components of the body. So it is protection against self, injury to self, also called as horror autotoxicosis. Predisposing factors, family history, certain HLA haplotypes, example rheumatoid arthritis, HLA DR4. Features of autoimmune diseases, elevated immunoglobulins, demonstration of autoantibodies, deposition of immunoglobulins or their derivatives at particular sites like renal glomeruli, accumulation of lymphocytes and plasma cells at the site of lesion, benefit from corticosteroid or other immunosuppressive therapy, genetic predisposition, occurrence of more than one type of autoimmune disorders in an individual, higher incidence among females, usually non-reversible, that is chronic. Pathogenesis, antibodies may cause damage by cytotoxic or cytotoxic type 2 reactions. Example, autoimmune hemolytic anemia, immune complex type 3 reaction. Example, SLE, sensitized T lymphocytes type 4 reaction. Mechanism of autoimmunity. So first is antigenic alteration. Cells or tissues may undergo antigenic alteration as a result of physical, chemical, and biological influences such as altered antigen or new antigens may elicit an immune response. Example, drug-induced anemia, leukopenia, thrombocytopenia. Viral infections such as infectious mononucleosis. Bacterial enzymes such as neuraminidase formed by myxoviruses. Mutation. Second, release of sequestrated antigens. Self-antigens that are present in closed system are not accessible to immune apparatus known as sequestrated antigens. So, immunological tolerance against these antigens is not established in fetal life. Example, Lens protein of eye leaks out due to injury and immune response induced and cause tissue damage. Spermatozoa develop only with puberty. They are not recognized as self and are immunogenic when they enter circulation. Example, in mumps or critis. The virus damages the basement membrane of seminiferous tubules, leading to leakage of sperms and initiation of immune response and subsequently development of orchitis. Cross-reacting foreign antigen. The similarity between some foreign and self-antigen is the basis of cross-reacting antigen theory of autoimmunity. Example, anti-rabies neural vaccine of infected sheep elicit immune response against sheep brain antigen, which may damage individuals' nerve tissue due to cross-reaction between human and sheep brain antigen. Streptococcal M protein and heart muscle share antigenic characteristics. Immune response induced by repeated streptococcal infection and can damage the heart. Nephrogenic strain of streptococci possess antigen found in renal glomeruli. Infection with such strain may lead to glomerulonephritis due to antigenic shedding. Molecular mimicry is due to presence of epitopes with identical peptide sequences in some infecting microorganisms and self-antigen that can initiate immune reactivity leading to autoimmune disease. Example, rheumatic fever, glomerulonephritis. Polyclonal B cell activation. Some stimuli non-specifically turn on multiple B cell clones and multiple non-specific IgM antibodies are formed. Such stimuli include chemicals, 2-mercaptoethanol, bacterial products, PPD and lipopolysaccharide, enzymes, trypsin, antibiotics, nystatin, bacterial infection, mycoplasma, viruses, EB virus, parasites, malaria. Forbidden clones, cells against self-antigen destroyed in embryonic life, and persistence of forbidden clones cause autoimmunity. Altered T or B cell function, enhanced helper T cell and decreased suppressor T cells function have been suggested as cause of autoimmunity. Classification of autoimmune diseases. There are total three. First, hemocytolytic, second, localized, that is organ specific, and third system, that is non-organ specific. So here are some examples of organ-specific diseases: brain, multiple sclerosis, thyroid gland, Hashimoto's thyroiditis, thyrotoxicosis, primary mixed anemia, stomach, pernicious anemia, pancreas, diabetes mellitus, insulin dependent, then adrenal gland, Addison disease, female, premature menopause. Non-organ specific, skin, systemic lupus erythematosus, scleroderma, kidney, systemic lupus erythematosus, muscle, dermatomyositis, joints, rheumatoid arthritis, SLE. Hemocytolytic autoimmune diseases. First is autoimmune hemolytic anemia. So RBCs which are coated with antibodies are prematurely destroyed in the spleen and liver. Serologically, two types of anemias with cold and warm antibodies. So first, cold autoantibodies are complete antibodies of IgM class and they agglutinate erythrocytes at 4 degrees Celsius but not at 37 degrees Celsius. Seen in syphilis, primary atypical pneumonia, trypanosomiasis and black water fever. Warm autoantibodies are incomplete IgG antibodies seen in therapy with sulfonamides, antibiotics, and alpha methylidopa. Lab diagnosis: Holmes test, the red cells are incubated with anti-human immunoglobulin antiserum. If autoantibodies are present on red cells, cells are agglutinated by the antiserum. Second, autoimmune thrombocytopenia. Autoantibodies directed against platelets occur in idiopathic thrombocytopenic purpura. Syndromed purpura is an instance of immune response against drug-induced neoantigens on platelets. Third, autoimmune leukopenia. Anti-leukocyte antibodies can be demonstrated in serum of patients with SLE and rheumatoid arthritis. Organ-specific localized autoimmune disease. So example, thyroid gland, Graves' disease, the majority of patients with thyrotoxicosis possesses antibodies to thyroglobulin. Symptoms are hyperthyroidism, exophthalmos, tremens. Lab diagnosis, anti-TSH receptor antibody test. Hashimoto's thyroiditis, thyroid proteins and cells autoantibodies targeted against thyroid antigen leads to suppression of thyroid gland. Seen in middle-aged females, hypothyroid state is produced, decreased production of thyroid hormones. Myasthenia gravis, characterized by abnormal fatigability of muscles due to malfunction of myonural junctions of striated muscles due to antibodies against its acetylcholine receptors. Thymus shows lymphoid hyperplasia. The lab diagnosis in that anti-acetylcholine antibody detection. Pernicious anemia, two types of autoantibodies are there. So first is directed against parietal cells of gastric mucosa and results in achlorhydria and atrophic gastritis. Second is directed against intrinsic factor and prevents absorption of vitamin B12. So in that, antibody to intrinsic factor is detected. Goodpasture syndrome, autoantibodies bind to basement membrane antigens on kidney glomeruli and alveoli of lungs, followed by complement-mediated injury, leads to progressive kidney damage and pulmonary hemorrhage. So in investigation, biopsies from patients are stained with fluorescent labeled anti-IgG and anti-C3b reveal linear deposits of IgG and C3b along the basement membranes. Then ninth is the autoimmune orchitis can occur as a result of mumps. There is lymphocytic infiltration of testes with circulating antibodies to sperms and germinal cells. Third type is systemic that is non-organ specific autoimmune disease. So one case study is there. A 27-year-old woman was referred to a rheumatology clinic with history of pain and swelling in the joints of hand and rash on the cheeks. So investigations, immunofluorescent test for anti-nuclear antibodies, that is ANA, showed homogeneous pattern anti-dsDNA antibody positive. ALE cells were demonstrated on bone marrow biopsy. Diagnosis: systemic lupus erythematosus (SLE) and treatment with low dose corticosteroid and showed improvement. Systemic lupus erythematosus. So we'll see it in detail. So pathogenesis is a chronic multisystem disease. Autoantibodies are produced against various tissue antigens such as DNA, nuclear protein, RBC, platelet membranes. Immune complexes, self-antigen and autoantibody are formed, which are deposited in various organs. So symptoms are age and sex. Women 20 to 40 years of age are commonly affected, and major symptoms are fever, butterfly rash over the cheeks, arthritis, pleurisy, and kidney dysfunction. Lab diagnosis: anti-nuclear antibodies. Anti-nuclear antibody positive in more than 90% of cases, used as screening method. Anti-double stranded DNA, dsDNA, highly specific, use for confirmation of cases. Anti-SM antibodies, detection of autoantibodies against various nuclear antigens by direct, indirect immunofluorescence assay, most widely used, an ELISA-based technique. ALE cell test no longer used because ALE cells are only found in 50 to 75% of the SLE cases. Rheumatoid arthritis. This is a symmetric polyarthritis with muscle wasting and subcutaneous nodules, commonly associated with serositis, myocarditis, vasculitis, commonly seen in women. Major symptoms: age and sex, women 40 to 60 years of age. Main features are arthritis, chronic inflammation of the joints, begins at synovium. Most common joints involved are small joints of the hands, feet, and cervical spine. Other features: hematologic, cardiovascular, and respiratory systems are also frequently affected. Typically, there is a circulating autoantibody called rheumatoid factor (RF). A group of autoantibodies against the host IgG antibodies are produced, and they are called RA factor. ACPA, anti-citrullinated peptide antibodies are also produced. Autoantibodies bind to circulating IgG, forming IgM-IgG complexes that are deposited in the joints and can activate the complement cascade. Lab diagnosis: rheumatoid factor. RA factor can be detected by latex examination or ELISA. RA factor is IgM autoantibody directed against the Fc portion of IgG. Anti-CCP, cyclic citrullinated peptide, by ELISA. This test detects human autoantibodies IgG against cyclic citrullinated peptide, which can be raised in rheumatoid arthritis. ACP, anti-citrullinated peptide antibodies, is autoantibody to citrulline protein, is highly specific. Rose-Waller test to detect RA factor is of historical importance, no longer used now. Sjogren's syndrome is a triad of conjunctivitis sicca, dryness of mouth with or without salivary gland enlargement, and rheumatoid arthritis. Antinuclear antibodies and RF may be found in sera. Ribonucleoprotein (RNP) antigens SSA, RO, and SSB, LA, present on salivary gland, lacrimal gland, and liver, kidney, thyroid, leads to immune-mediated destruction of lacrimal and salivary glands, resulting in dryness of eyes, keratoconjunctivitis sicca, and dryness of mouth, that is xerostomia. Lab diagnosis: detection of SSA, anti-RO, SSB, anti-LA antibodies by indirect immunofluorescence assay.
Hope you find this session useful for your understanding and for your exams. Thank you.